Hello, everybody. This is Dr. Kevin Connors. Welcome to another episode of Holistic Health Hour. Remember, you can ask your questions ahead of time if you think you have some questions on our holistichealthhour.com website. And you can see all past episodes of our Holistic Health Hour on the holistichealthhour.com website. They're nicely tabbed with information, so it can be um, very beneficial if you're looking to get some questions answered. Also, I recommend you go to our website, connorsclinic.com, where we have well over 1,000 blog posts on all sorts of different topics. Um, you might find your answers there, but let's jump right into the questions. Remember, you can chat in your questions. Let me open up the chat here real quick and connect to the chat. So if you do have questions, feel free to chat in any questions about any health conditions. If I don't know the answer, I will say I don't know the answer. Okay, so let's get started. How do I treat a toddler with ear infections? Also, how do I treat an infected small wound from a burn? Okay, two questions. So, toddler with ear infections. Well, uh, historically, we used to try to try to educate parents because historically, people back in the 80s and 90s and early 2000s, if their child would go in for pediatric well checks and the doctor would look at the child's ear and whether the child had symptoms or not, if you saw a bulging um, eardrum, they would say your child has an ear infection and they would write a prescription for antibiotics. They'd literally give antibiotics like candy for ear infections. Many times, if the child was pulling on their ear and or complaining of ear pain, parents would run to their pediatrician and get antibiotics for ear infections. And we used to argue, let's say, try to educate parents at that time because statistically, it's well documented that over 90% of ear infections in children are viral. Therefore, antibiotics aren't going to work. So, antibiotics are only going to work on a bacterial infection. Viral infection is not going to touch, it's only going to do more damage than good. So, you don't use antibiotics. So, typically, you're not going to go to antibiotics for ear infections. But I do realize that um, while most ear infections will pass over time with no treatment needed, since it's viral and viruses will run their course, some kids are prone to constant ear infections, and that can be an issue. Many times it's because of just genetically the shape of their ear canal, and fluid tends to puddle in there, and they can end up with external ear infections that can lead to infections of the drum. Many times it can be, um, some other underlying cause giving a middle ear infections. Um, so what do you do? So there are some natural things that you could do for external ear infections. External means external to the drum, and there's some natural things you could do for middle ear infections. The external ear infection, there's garlic oil. Um, Herb Farm makes a good garlic oil that you could drops that you could put in a child's ear. You can put hydrogen peroxide, 3% hydrogen peroxide in a child's ear to kill any external ear infection. So that would be also known as swimmer's ear. If it's a middle ear infection, probably what this question is based on, then you want to treat the child as far as building up their immune system to help them be able to deal with viruses. So things like vitamin C, zinc, echinacea. Um, there's different liquid herbal formulas that are created for children that can help build their immune system and help them be able to fight off viral infections. Getting adjusted, going to a chiropractor, getting adjusted, their upper cervical adjusted can be extremely helpful for children with ear infections. Then the second question also, how do I treat an infected small wound from a burn? Well, um, that's a tough question to answer because it depends on how deep the burn is, what level of burn it is. Um, if you're trying to if you have an infected wound, there's topical, from a medical standpoint, there's obviously topical antibiotics, triple antibiotic ointments and things. From a natural perspective, a person could use honey that could help heal a wound and kill infection. A person could use topical hydrogen peroxide. There's different topical ointments that are, if the wound is a closed wound, it's not open anymore, you could use comfrey. If it's a closed wound, you could use calendula. There's other different ointments that a person could use on a wound. If it's a burn that needs to be treated, if it's a third-degree burn or something like that, you're going to end up going into the ER, then you don't want to be putting anything on it until you get in there, because they're going to have to scrape that off. But if that's not the case and it's a small burn and it's just a wound that seems to be festering and open, then you want to make sure that it doesn't get infected. So that's where a topical antibiotic, hydrogen peroxide, or even honey can be helpful in those cases. Next question, will your stay-at-home care offer genetic counseling for non-cancer folk? So our stay-at-home care, so understand our clinic, the way we operate is everything is at a distance. We've done that for years. So we've done genetic counseling at a distance for, probably 10 years. So there's no need, there was never a need to come in the office for counseling to go over a person's DNA. So we always did that at a distance. And we always have done genetic counseling for non-cancer patients as well. So yes, you can purchase our, that also comes with what was a course on what I created lots and lots of videos on the genetic pathways. I'm sure I have a lot of them available outside of the course on our blog post and on our videos website as well. But I put those videos in a course to help a person understand their genetics. So we use a company called DNA Supplementation to run genetics because it gives you the broadest base of picture of genes. This was a question, I think, last time about genetics and using there's a lot of different genetic companies now. And there's a lot of them that'll say, here, it's $250 to get a genetic picture for possible weight loss help, or for possible food allergies, or for possible, pick the condition. I'm not in favor of those. Our genetic picture looks at all your genes, and then we give you that full genetic picture readout. So when you do genetics with us, we give you the full genetic picture readout, which is called a full genetic report, and it's about 350 pages. It's overwhelming. So we try to break it down. So then we give you I go through all of that, and I'm the one who goes through it for a person and types out a genetic summary. So that's about 20 pages long. So we give you a genetic summary. So go ahead and look at your full genetic report, for fun, and if you really want to nerd out on all your genes. But then look at your genetic summary, because these are the genes that we need, to be concerned with that could be issues. That's still a lot of pages. Then I also give you another report that's called your genetic action steps. So it's really, based upon everything that's going on, these really should be your action steps, in my opinion. And you get all that data with our genetic report. The other reason why I don't like those genetic reports that say, here, run this genetic report for you're trying to lose weight. This will tell you the genes that you need to support if you're having issues with losing weight. It's because there's a lot of half-truths with that. So your genes genes can cause issues. If you have defects in your VDR, your vitamin D receptor genes, you're going to probably have issues holding vitamin C, absorbing vitamin C, utilizing vitamin D. And if you ran a vitamin D blood test to see your level of vitamin D, you'll notice that it's low even if you're taking vitamin D. Well, if you look at somebody's blood test and their vitamin D levels are low and they don't have genetics done on them, it's a pretty good chance that they have defects in their VDR, their vitamin D receptor genes. So knowing that you have defects in those genes, it might be a good idea to take extra vitamin D. So there are action steps that a person could take looking at one's genes. But you can't say, oh, I am obese because of my genes. Nor can I say, I have constant infections because of my vitamin D receptor genes. Well, there's factors that play into that. Yeah, if you had a higher level of vitamin D, would you be able to fight off viral infections more readily? Sure. So there's action steps that you can take based upon your genes, but your genes don't make up your life per se. It's much more of an epigenetic factor that makes up your illnesses or lack thereof than it is your genes. But we do think it's important to look at one's genes because looking at one's genes, it gives you ideas of things that you can support. Let's say if I have a lot of defects in my phase 1 detoxification pathways in my liver, then it's a good idea to support those. Maybe that's why I'm a slow detoxer. Maybe why I don't get rid of things as fast as my wife does. And I end up with liver issues or possibly cancer issues. So knowing your genetics can be beneficial, but it doesn't shape your whole life. So, and certainly knowing your genetics is not going to say you have specific food allergies. But it says, hey, if I have HLA gene defects, then I have a greater propensity to having allergies to gluten and dairy and things like that. But that doesn't mean I do. So I think it's better to take a bigger look at your genes. What I always say, a 30,000 foot view of your genetics, and look at all of them and see how they interplay and interact, and then treat the person, make suggestions on how to care for the person based upon that, make lifestyle suggestions based upon that. Another example of, I think, ill advice, wrong advice around genetics has been, for those who are have some information on genetics, would be the methyl tetrahydrofolate reductase genes, the MTHFR genes. Those were some of the first genes that were recognized, and many times I'll have a patient come to us and say, hey, I have a double allele defect on C677 MTHFR gene, so I have to take methyl groups, and so I'm on methylfolate and I'm on methylcobalamin, and I'm having all these issues. Well, if a person only ran those, if a practitioner only recommended getting a genetic test that had those in the mix and not some downstream genes in the mix, you could actually do more harm than good to the patient, because you could be over-methylating the patient because they have that MTHFR gene defect. You think that they need more methyl groups. You're over-methylating them because you didn't look at the big picture of their genes, and they have defects in their biopterin pathway, which can lead to emotional issues and serotonin issues and all sorts of problems. So long answer to this question, but yes, we do genetic testing, and yes, we do genetic counseling, if you want to say that, support for people based upon their genetics. And yes, doing it at a distance is really the way to do it. But you want to get genetics done where you're going to see as many genes as possible so you can see the whole mix of how they interact, because your genes are simply ways that your body makes proteins and makes hormones and makes things. That's what your genes do. And we want to look at how those all interact from a physiological standpoint. Oh, hopefully that wasn't too long of an answer to that, but hopefully that will help. Next question. I've started taking HCl and berberine for H. pylori. I was taking one berberine with my meals 3 times a day, but I noticed that the berberine was making me incredibly fatigued. I took it away for a couple of days and continued the HCl to confirm. Is it okay if I take the berberine all at once after my last meal of the day? How do you suggest someone take it for a current H. pylori infection? So berberine would be one of my favorite things to take for an H. pylori infection. Berberine has other benefits as well. It's a great cancer killer, and it can help with other bacterial infections and even viral infections. It's one of my favorite supplements. Um, I haven't had a lot of people that have said that berberine makes them sleepy, makes them fatigued. It quite possibly may be the die-off of H. pylori. So H. pylori is a gram-negative bacteria. Gram-negative bacteria so you might have heard of gram-negative bacteria when someone's referred to Lyme disease too. Borrelia burgdorferi, the bacteria in Lyme disease is a gram-negative bacteria. Gram-negative bacteria are called that because they stain with a gram stain differently than gram-positive bacteria. And the reason why they do is because they have in their cell membrane, they have uh, lipopolysaccharides, which is a long-chain saccharide, and that lipopolysaccharide will be liberated when they die. So if for someone to get fatigued after taking berberine, I don't think it's a function of the berberine per se, but it's probably a function, and I'm just thinking this through, probably a function of the berberine. Well, it could be two things. It could be a function of the berberine actually killing H. pylori and liberating lipopolysaccharides and giving the person a Herxheimer reaction. So a Herxheimer reaction is when you produce a lot of endotoxins, and most commonly it's through the death, the killing, the lysis of gram-negative bacteria, spilling tons of lipopolysaccharides into your bloodstream, and then your liver has to get rid of it. So when your liver is overwhelmed getting rid of endotoxins, in this case lipopolysaccharides, it can fatigue you. It can make you feel icky. It can make you feel ill, almost fluish, just really tired. That's what's called a Herxheimer reaction. It's been defined as a Herxheimer reaction. And Lyme people will often say that they got a Herx reaction. But that can happen whenever you're killing, especially gram-negative bacteria. So that could be a possibility that you're actually killing the H. pylori, which is a good thing. So certainly, yes, you could change when you take it. You could take it all in the evening. You can play with that dosage. It's not necessary that you need to be killing that bacteria, 24/7. So certainly you can play with it. The other possibility is that berberine does have other physiological functions in your body. It can lower your blood sugar. So if the berberine is in fact lowering your blood sugar, causing you to have fatigue because you have hypoglycemia, that's a whole other ball of wax. So if you have a glucometer, it would be a good idea to check your blood sugar levels. You don't want your blood sugar levels to drop, below 70. If they drop, below 70, 75, when you're not trying to keep your blood sugar real low, like in the case of a cancer patient, but if they drop down below that level, you can have fatigue and exhaustion because of hypoglycemia. So that's another possibility, easily measured. Now, normally after your blood sugar goes up, but then it's supposed to go back down to normal, not dipping down to a hypoglycemic state. So do check that as well. If you do have hypoglycemia from berberine, it's quite possible that you have a level of hypoglycemia without berberine that you might not fully recognize or notice. So having a glucometer to check your blood glucose levels would be a good idea. to be able to diagnose hypoglycemia. And then the treatment for hypoglycemia really is going to be to not eat 3 meals a day, but to break that up into maybe 6 meals a day and have food in front of you all the time so that you can keep your blood sugar regulated. And where would you get a blood sugar checker, a glucometer? Well, you could just get that at Target. You can prick your finger and check your blood sugar. It's pretty simple to do. Next question, how do you fight endometrial lung cancer? So I think we had this person ask this question last time in a little different way. But I think you're asking lung cancer, endometrial cancer that has metastasized to the lung, because the endometrium is a distance away from the lung. Coming from endometrial cancer that was removed in 2012 from a total hysterectomy, do you fight it with hormone therapy or chemo or what? It's not a question I can just answer real simply on a holistic health hour here. So you need to, work with either our clinic or a clinic that's going to treat you as far as looking at your whole picture. So if you have endometrial cancer that was treated in 2012 and now it's metastasized to the lung, and how would you know that? Is if you have lung issues and they see a mass, they do a biopsy, and it's actually endometrial cancer in the lung. So lots of times people don't realize that when you have metastasis of a cancer to another spot in the body, it's still that same cancer. So how would we treat that? Again, we don't treat cancer, but we treat the person. And how would we care for somebody with metastatic cancer? Is we certainly use Rife technology, and we'd use nutrition and diet and work along with your oncologist if you're going to be working with an oncologist. Can you use hormone therapy? Well, if it was estrogen receptor positive or progesterone receptor positive or HER2 positive in the first place, and they did another biopsy of this one, they should be checking whether it's hormone positive or negative with this one, because just because it was with the first one does not mean it is with this one. So hormone therapy might have no effect on it. Would you use chemo or what? Possibly. It totally depends on the person, depends on what's going on. I just can't answer that. And I'm not a practitioner that is completely against chemo, but I think you should be doing other things as well. Okay, this is a very long question. I have bursitis in both legs, fibromyalgia, and Hashimoto's. I now eat a plant-based whole food diet. It's been a great process of education and experience. 5 years ago, I did new physical therapy exercise that flared both hips so bad that the left leg and hip down is still overreacting. It put me into the worst fibromyalgia flare I have ever had. I was flare-free for close to a year at that point. Unfortunately, I had to do cortisone injections and a round of prednisone to calm down the inflammation. I can finally walk with assistance devices and slowly have been able to walk a block or so. I recently have had my left side start to seize up again. The stretches, I have to be very careful. I am an overstretcher. Gentle yoga, dry needling, and cupping massage seem to help, but then it's like the hip muscles and left leg muscles grab and don't let up. Is there anything you can do that would help? I have learned biofeedback techniques to release muscle tension, but it doesn't help much after walking activity. Okay, so I don't know who asked these questions, but I don't know if you have joined our chronic disease and autoimmune course. So if you go to our website, connersclinic.com, you'll see up at the top, I have courses. So I've created courses for people to try to help them get educated on how to self-care. Because I believe we're moving into a time where you have to take responsibility for your health. And this person is obviously doing that. and asking good questions. But you'll find with an autoimmune disease. So let's talk about that. Bursitis in both hips. Well, a bursitis in both hips could be, just from a local injury, right? You could have inflammation because of a local injury. You could also have bursitis and joint issues that are from systemic inflammation. So, and the systemic inflammation can be due to an autoimmune flare. Now, a person has fibromyalgia. What's fibromyalgia? Fibromyalgia is just a collection of symptoms. It's not a disease in itself. It's coming from something. So many times people with fibromyalgia actually have antibodies, self-antibodies to their muscle tissue and or their myelin sheath cells in the brain and or their fibers in the muscles that cause contraction and or arthritis, arthritic antibodies and or rheumatoid antibodies. It just goes on and on. So fibromyalgia is caused from something. We'd want to find out what antibodies this person has. Hashimoto's is antibodies to either thyroglobulin antibodies or TPO antibodies. That's to your thyroid gland. So first step, as far as if I was going to manage this case, would want to get a Cyrex Array 5 and maybe even a Cyrex Array 7X panel on this person. Those are blood tests to find out what antibodies you have, so that we know what we're dealing with. That's going to be more diagnostic to give us okay, this is what is going on. Then as far as how to treat it, is that when you have self-antibodies, so we already know this person, you already know you have a diagnosis of Hashimoto's, you already know you either have TPO antibodies or thyroglobulin antibodies. So we have antibodies to the thyroid gland. So whenever you have a diagnosis of an autoimmune disease, aka antibodies to any self-tissue whatsoever, there's anything can flare it, from physical activity, that's too great, physical injury, which can increase cytokine activity, which is inflammatory, and that can flare up the autoimmune disease and just cause this giant snowball effect flare, to exposure to a toxin or a mold or a food that you have an antibody against. I mean, it's just, these are things that cause flares. So you alluded to that term flare. So from an autoimmune perspective, we call it a trigger. So what is the trigger that's causing the flare? That's what we need to identify. Whenever you're dealing with an autoimmune disease, you've got to find your triggers. You're never going to win if you don't figure out your triggers, and they can change. So running a food panel, which would be like a Cyrex Array 10 food panel, looking at the gut issues that you might have, which would be a Cyrex Array 2. So Cyrex has the best antibody panels. That's why I keep using that lab's name in answering this question. So looking at the level of leaky gut that a person has. Do they have paracellular leaky gut? Do they have transcellular leaky gut? Do they have lipopolysaccharides, antibodies to lipopolysaccharides, which would be the worst level of leaky gut? Do they have antibodies? What other self-tissue do they have antibodies against? And then what foods do they have antibodies against that at least we know we need to eliminate those triggers? And then do we need to run a mycotoxin test or another, full toxin load test to see, what exposure that you have to different things that could be causing triggers. That could be a trigger that are causing flares. So that's how you need to kind of figure this out. From an immediate standpoint, as far as nutritive things that you want to do, it'd be a good thing to get on like an autoimmune diet right off the bat, even before you're checking these things, to make sure that you're not taking any immune stimulants. This is probably the number one thing that we see with people that maybe even know they have an autoimmune disease. They have Hashimoto's, and then they're taking vitamin C and garlic and echinacea and all these immune stimulants on a regular daily basis. You can't do that. That alone is going to be a trigger. You can't stimulate your immune system. What are you going to kill if you stimulate your immune system? You're going to kill that which you have antibodies against first, which is self-tissue. You're going to cause these flares. So you've got to get off of all immune stimulants. And then, as far as supplementation, the things that a person should be on in general would be the flavonoids, the anti-inflammatory nutrition like curcumin and boswellia and white willow bark and things that are going to calm a Th1 response, rosemary, quercetin, things like that. So, we have to kind of uncover the onion a little bit and see what layers that we're dealing with. And I hope that helps. So if whoever asks this question, if you have a practitioner that you're working with, show them this video if you want. If you don't have a practitioner, you can make an appointment with me. And if anybody listening to this, if you do want to make an appointment with me, you can just go to our website, connorsclinic.com, and you can self-schedule, or you can call the office if you want to and discuss the possible ways to work with us. But you'd schedule what's called a case review, which is your initial consultation with me. We don't take everybody as members/patients, but if I think I can help you, then when you like what you hear, then we can work together. But I don't think I can help you. I think you're better served locally, then I'll tell you that too. So hopefully I helped answer that question. This question was asked last time, but our last video got so muffled. I don't know what was wrong with our connection, so I'm going to answer it again. My 17-year-old son pulled a tick off his stomach Tuesday morning. This is probably a month ago now. And I'm not sure if he got the whole thing out. It was red around the bite. Is it necessary to get the whole thing out, or will it work its way out? Now, your body will heal if you leave anything in it, like a sliver or part of a bug, proboscis of a bug. But it's much better to get it out if you can. If this tick is infected, if this tick does have Borrelia, then it's even more important to get that out, because the infected part is probably going to be the proboscis that's left in the tissue. So I'm sure this was already taken care of, but for anybody moving forward that would have the same question, and you want to try to get it out, there are some little tick dislodging tools that you can buy on the internet. We used to sell them in our store. I don't think we have any anymore, but you can just buy them on Amazon for your dogs or your cats or your children or yourself. They're just little hooks that go around the tick and you twist. It's called tick twister or something like that, and it pulls the tick out real nice. Good thing to have. But just because the person got a tick bite doesn't mean that they have Lyme disease or that tick was infected. Even if that tick was infected, you have the possibility of your body killing off the bacteria, and you never end up getting quote-unquote Lyme disease because your body killed it. That's what your body's supposed to do. Your immune system is supposed to kill enemies that are trying to attack it. It's when your immune system is down or the infection is too great that it becomes more of a problem, and the person can end up setting up with chronic Lyme. If a person does think that they have an infection and they might have evidence of that, they might have a fever, they might feel ill, then I do think, knowing that, hey, I got the tick off, but I'm feeling ill, or my child's feeling ill, they have evidence of a fever, they don't feel well, I do think it's wise, knowing how bad Borrelia could be and how bad chronic Lyme could be, to get an antibiotic. The typical antibiotics that will be used is doxycycline. and or amoxicillin, and I think it's wise to go on that. Now, the course of days depends on the Lyme literate doctor that you're going to go to. Anywhere between 10 days and 30 days would be the course of treatment. Is it always suggested to follow that course of treatment? I legally can't answer that question. So you're going to have to make some decisions on your own there. Question came in the chat. I've had a significant reduction in the last month of the size of my lymph nodes. I've been alternating ivermectin and fenbendazole along with other recommended treatments. Coming up on the last week of the fenbendazole treatment and asking if I should stick with fenbendazole or switch back to ivermectin for the next 6 weeks. So just understand, I can't legally answer a question regarding medication on this platform. We are live on Facebook and YouTube and etc. So I have to be careful of that. So this person should contact us and we can talk about that. Fenbendazole and ivermectin have both gotten really good reports in the last couple months with some data that has come out for treatment of cancer, and where doctors have been poo-pooing it. Matter of fact, we had the FDA come after us, what was that, a year and a half ago, that made us take down all our data on our website on fenbendazole. They sent me an 11, I can't remember how many page letter, but it was like threatening to sue the pants off me if we didn't follow through immediately with taking everything down, and we had 7 days or something to get everything taken down. What a crock. But it's that's the things that we deal with. So I apologize that I have to be careful with any advice on any medications put out to where the world would see that. YouTube is taking down our videos almost on a weekly basis as well. Silly ones too. It's like, really? You could have picked a little more controversial video to take down. Of course, it's just their AI that's picking stuff up. But it's a little frustrating that they can have pornographic videos all over YouTube, but you can't have videos that tell people to take mushrooms for their immune system. Okay, so next question that we had. So keep asking questions. Apologize, I can't answer that one once there. But yeah, in general, basically keep alternating or stick with what's working. Obviously, you want to stick with what's working. There isn't anything wrong with when you're dealing with anything to pulse stuff. So pulsing nutrition and or what you asked about here can be beneficial. Our body can get used to things. So going off of things for a couple weeks or switching to something else for a period of time can be beneficial. So you can see better results too. So don't feel bad about doing that. Next question that got asked. We have time for a few more. What's the best treatment for indigestion? Well, indigestion is a word that encompasses a lot of symptoms. So if a person has a lot of gas, or a person has constipation, or a person has diarrhea, a person has tummy aches after they eat, a person has burping, belching after they eat, a person has heartburn. All these things could be called indigestion. So we'd want to know a little bit more information. But in general, most gut issues really start with an issue with, most commonly, a decreased hydrochloric acid production in the stomach, which leads to a lot of stress on the pancreas and production of enzymes. So, the basic general best recommendation for people with any tummy issues whatsoever is to start taking some HCl with digestive enzymes. Now, you could get a person with such bad gut issues that they take HCl with digestive enzymes. You only take those with your food, so you take it with a meal. So a person will say, I did that, and it just caused really bad pain in my stomach. Well, then you got to kind of take a step back and um, treat the gut, because you probably have just a slight ulcer, or some serious irritation. Maybe you have to go to use some gut healing products like slippery elm. I'd have a whole protocol on this on our website. If you go to our website, connorsclinic.com, and you search hypochlorhydria, hypo means low, chlorhydria, hypochlorhydria is low stomach acid, okay, low hydrochloric acid in your stomach. So if you search that, I have a whole protocol, and it kind of walks you through. If you have really bad pain, then switch to go off of the HCl, try apple cider vinegar for a period of time. Still have pain with that, then maybe try slippery elm. There's a new product by Zymogen that's really good called GI Soothe that's really beneficial. Little kids can take that. It's the chocolate flavored tablet that you can just suck on, because you want to heal the tract all the way down, even the esophagus. That will help heal the stomach and the esophagus, to a point where a few weeks later, then you could start taking apple cider vinegar with your food, and you could tolerate that, and you're starting to do a little bit better. And now you could take HCl and digestive enzymes with your food. Of course, there's all sorts of other things that encompass indigestion, from diarrhea and constipation. And again, the next thing that happens after HCl deficiency is what's called leaky gut syndrome. And leaky gut syndrome, there's really 3 levels of that when you have intestinal permeability, and you can test for that. So that's the Cyrex Array 2 test. But short of that, just trying to heal the gut, trying to find food sensitivities, trying to find the things that are causing flares, to try to settle that down is the way to go. Next question. My daughter gets anxiety, especially around her cycle. What could be the cause? Well, any type of mood issues with your children, and obviously around her cycle, she must be 13, 14, 15 years old. You certainly think, if any type of issues around a person's cycle, you think of hormonal issues. The most common hormonal issues in young adults are just a decreased functioning adrenal gland. Many times these kids are fairly stressed with school and the pressures of school. Decreased functioning pituitary gland. Just getting them on some adaptogens is the number one thing to look at. Adaptogenic herbs are called adaptogens because they help you adapt to your environment. And they do so, they help balance your thyroid and your pituitary and your adrenal glands. And those are the glands that control, progesterone and estrogen output, and can help with any issues with your cycle. So that would be the first thing to start. Obviously, getting tested. There's some adrenal stress tests out there. There's hormone Dutch tests that also test the adrenal glands and look at that. Also, genetic issues can be an issue with that. I mentioned earlier that a person that has defects in their genetic pathways, called the biopterin pathways, can be more prone to imbalances in neurotransmitters. And then certain dietary things can cause an influx, can push that pathway too hard, and cause excess or deficiencies in dopamine or serotonin, or other neurotransmitters as well. And you want to look at that. There's all sorts of other issues that can cause mood disorders, whether it be anxiety or depression or OCD or inability to handle stress. So we'd want to take a deeper dive into that, because that could be a very serious problem. So we want to be aware of that. Question from the chat. My father is beginning to slip mentally with memory and cognitive function. What would you recommend supplement-wise? I've been researching NAD. What is the best if you had to pick one? Well, usually with early dementia, Alzheimer's, any type of memory loss, um, just right across the board, there's inflammation in the brain. Now, you could have an argument with people on what's causing that inflammation, because the truth is a lot of things can cause that inflammation. Um, it's why I'm very much against the flu vaccine for elderly. They push it so hard on the elderly. Has way too many micrograms of aluminum in it, and it's the size of aluminum is they say it's really small, so you don't have to worry about it. Well, you have to worry about it even more because it's really small. It easily crosses the blood-brain barrier, and it's a source of inflammation. All the studies out there on Alzheimer's, brain inflammation, microglial priming, um, antibodies to neural tissue tie to infection and toxins. Also, possible injury like post-concussive syndrome. So people that have had concussions through their life are going to be much more prone to microglial priming, which leads to, depending on where it is, which can lead to dementia and loss of brain function, or Parkinson's, or full-blown Alzheimer's disease. So I have a video on this on our website. It's called neuroinflammation and microglial priming. So on the website, if you search neuroinflammation, you'll see that. And it goes into depth about that. And it goes into depth about what supplements to use. In general, the supplements that you would want to use would be anti-inflammatories. So would you take this person and try to do chelation therapy to pull out the heavy metals if this person has heavy metal issues? Well, personally, I wouldn't do that unless we did a full workup and figured out what could be the cause, so we know what we're dealing with. But in general, you'd want to decrease the inflammation. So the way you decrease inflammation is using flavonoids. What are flavonoids? They're supplements like curcumin, I mentioned them before, rosemary, quercetin, boswellia. We have a product that has a bunch of them in it. It's called Clear Inflam. There's another product called Caparest that has a bunch of them in there that we use both of those a lot. But taking, a bunch of flavonoids and get on an anti-inflammatory diet is the key. Also, I'd say I don't know if your dad's a drinker, if he likes his beer or he likes his hot toddy at night. Alcohol is the worst, culprit. In all the research on brain inflammation, he's got to get off alcohol. And then other things that are common that can cause more inflammation, gluten is a key factor. Look at other food sensitivities. But number one is getting them on flavonoids. Have them take a lot of flavonoids. Yeah. All right, well, that is all the time we have for today. I hope that helped. Remember to go to holistichealthhour.com where you can see all our past episodes, and go to connorsclinic.com where if you so desire, you can make an appointment with me, or you can just visit our blogs, or you can go and join one of our courses and you can get more of me than you really want. But it will help you walk through a lot of things that you might be dealing with. So feel free to do that. I wish you the best. Thanks so much. And I will talk to you soon. We'll talk back next week. Remember to go to holistichealthhour.com to ask questions as well. All right. Guys, have a blessed day.